Toby, what a time to be Chief Executive of McKesson UK. How does it feel for you in the role, but also for the business more generally?
Look, I mean, I'm super proud to be part of McKesson. It has, for a business, been really challenging. We were going through a transformation pre-COVID, and because of COVID, we decided to further accelerate our strategy. Whilst at the same time, I'm really proud of how the teams have completely stepped up to help serve the NHS. We were extremely busy during the first wave of COVID, trying to make sure we could secure medicines. We had people from our support centres and call centres going out to warehouses to help ensure our trucks got to hospitals. We helped set up emergency field hospitals within 48 hours for the government. And particularly in retail pharmacy, we were extremely busy with helping people get medication, which was particularly important when GPs closed their doors, and our Lloyd's pharmacies were the only places open for access to healthcare in the community. And so from a personal perspective, I'm really proud of what the team's been able to do. I mean, it has been hugely challenging, particularly during the more difficult times during COVID, and how the team's been able to really support people in their communities and provide access to healthcare, whilst we've done some incredible things around really accelerating our digital online pharmacies to give people access to their prescriptions when they wanted to access it digitally as well as in pharmacy.
And that's really interesting, Toby. Say a bit more about, I suppose, the lead that McKesson Lloyd's Pharmacy has kind of taken in the sector, because actually I know you guys were the first to do quite a lot of this stuff.
That's right. I mean, our retail pharmacy team are terrific, and they were often having to make decisions that we'd never come across before. And we are a very regulated industry, and normally change takes quite a while to happen. But to make sure our patients and our employees were safe, we had to take a lot of early decisions. So we did want to make sure that our employees felt safe and comfortable when everybody else was closed and everybody else was at home. Our employees were asked by us to go and serve the public. And so we were the first people to put up plastic screens. We were the first people to ensure safe social distancing within a pharmacy. And we changed some of our opening hours so that our colleagues had a time for a rest between serving patients. And it was still incredibly difficult, but I think those early decisions helped give our employees and our customers, I think, confidence that we were trying to do the right thing.
So Toby, I mean, previously you were CEO of Asia and Eastern Europe at A.S. Watson. So what attracted you to take on this role with McKesson UK?
I'd been away from the UK for 12 years. I was traveling a lot, and I wanted to pivot my career away from Asia to the US and back to Europe. My mother also passed away, and my kids were born in Asia, had never lived in the UK, and I thought it was a good time for them to come home. From a career perspective, I thought McKesson's was a sort of once-in-a-lifetime opportunity. I'd really believe healthcare is being transformed. This is the moment to be in UK healthcare.
I mean, that's so interesting, but it must feel quite different to a business like A.S. Watson. I mean, sort of structurally and how the business operates. Say a bit more about that.
They are different. They're both two extremely successful organisations. A.S. Watson's has a very strong Asian core in its values, driven by a hugely successful entrepreneurial founder, Mr. Li Kai-shing, to working for a large US Fortune 10 corporation. As I said, both organisations have huge strengths, but they are different. And adjusting to that and adapting to that obviously takes some effort and time. I think the other sort of thing that I would mention would be, of course, the regulatory environment in Europe is different to being in Asia, and particularly when you're dealing with medicines and the supply of medicines, and you have responsibility for the safety of patients. There is an awful lot of stakeholders that I need to try and help manage and influence. Of course, we are very deeply connected to the government and various other non-profit organizations, both governmental and otherwise, to ensure that we can provide great patient care and run a successful business. And so that part is different to a lot of the work that I'd done in Asia and Eastern Europe.
Do you notice a difference between the relationship people in the UK have to their community pharmacies versus what you've seen elsewhere in the world?
Not really. I think community is important for everybody, regardless of where you live and your background. I think people like to feel connected. I think technology has done an enormous good in many parts of the world. It's created a more equal platform. But in the end, I think people like to do business with people, and I think communities are important from wherever you come from.
So let's come back to the McKesson, where the business fits into the global group, because a lot of people, in this country will know McKesson as a certain company, but of course, when you look at what they have in the rest of Europe, what they have in the US, actually, it feels quite different, doesn't it?
Yes. So for McKesson overall, it is a large global organization. By far, most of the businesses in the United States. And so in that way, the US is a very big brother for us here in the UK. We do, however, have a much more diverse portfolio. McKesson UK is really interesting because we're essentially sort of a portfolio of businesses. We are the largest pharmaceutical distributor in the country, supplying hospitals and pharmacies. We operate Lloyd's Pharmacy, which is the second largest pharmacy chain in the UK. And we have our clinical home care business, which provides clinical treatment for people in their homes. And, we're also more recently Europe's fastest growing online pharmacy. So we have a real spectrum of businesses. What is unique through that, though, is the flow of medicines through our business, from the pharmaceutical company through our wholesaling business, through to retail pharmacy, and then through our digital businesses, or with nurses visiting patients and customers at home.
You took on McKesson, at a particularly challenging time, really, around a lot of changes to pharmacy reimbursement, lots of impact actually on the profession of the pharmacist. What were your priorities at the time, and how do you feel you've done over the last couple of years?
Yeah, I think you're right. The cuts to community pharmacy in England were significant, really significant, and they fundamentally changed the economics of that industry. And so it's very fair to say we had a burning platform. So my immediate focus when I walked in the door was to put in some urgent operational fixes. We had some payroll issues. We had a high pharmacist vacancy rate, which is hard when you're running a big pharmacy chain. We had availability of medicines wasn't as good as it should be. So I immediately tried to fix some of those. And I went on what I would call a voyage of discovery. Over about 8 weeks, I looked around our business, talked to employees, talked to customers, talked to the government and various other stakeholders, and pulled together a plan on how we can turn around this business within those first 8 weeks to present to our board. And to be honest, it wasn't completely perfect, but it was directionally right. And that plan is the one we still use today. Putting together the strategy for the UK to turn this business around, to help transform McKesson UK and healthcare in the country, there were a number of key things. The first one was we wanted to put people first. We employ more than 20,000 people in the UK, and this is a people business. But I recognized that our teams didn't always have the right tools to do their jobs as best as they would like to do so. And so we fixed the payroll. We went from having more than 8 different payroll solutions and 20 different types of terms and conditions to a harmonized one, so we can be fair for our employees. We looked at putting in place a new dispensing system because our old one was 20 years old. And the dispensing system is crucial in a retail pharmacy. But we've also done things around using technology such as Loop, which is a communications platform that you can have on a mobile phone. Most of my employees do not have access to a computer on a daily basis because they're serving customers or patients, or they're driving trucks. And so having simple video messages and communication tools like that means we can connect with all of our employees, not just a subset of them. And that became really important during COVID, to try and share with people what we're planning to do and get more two-way, multi-way communication. The second key thing we looked at in our strategy was creating an omni-channel solution for our customers. We acquired Echo, a startup online pharmacy, slightly more than a year ago now, and we've been growing that very aggressively, giving customers the opportunity to utilize both an online pharmacy, but also the best of a bricks and mortar one. And our Lloyd's brand now has been growing very fast as a consequence. The third aspect was what we've called delivering on our promise in wholesale. The most important things for our wholesale customers is that we turn up on time and we deliver to them the medicines that they need at the time in which they need it. And of course, at a fair and sensible price. So we've been putting a lot of effort into improving the operational aspects of running our business and putting in place some new technology and systems to help being able to do so. During COVID, we put through tremendous volumes of medicines to hospitals at very short notice. And we were able to flex up our organizations because of the way we've been managing our business and some of those investments. The fourth area was around growing what we call our home care business. So this is often very expensive medicines where a patient requires the support of a clinical staff, such as a nurse, to administer. And there's a lot of growth in these medicines from big pharmaceutical companies. This is a great business that helps patients to have treatment outside of a hospital. If we can't provide them this treatment, they have to end up living in a hospital. So it really improves the quality of life for our patients. Other areas, it would be around, fifthly, reducing our cost to serve our patients and our customers. So we've brought a number of our support centres together into one place, partly to reduce cost, but also to improve team working and communication. And we also reduce a number of management layers between me and the people in the field to help speed up decision making. And lastly, I think we've worked hard on proactively partnering with the government.
I mean, how much of you and your team had to really work on that kind of external stakeholder management, upwards into government, the NHS? There are a lot of people very interested in what you guys are doing.
We have changed quite a lot our company focus on this. In the past, we were very reactive, and I was interested talking to big pharmaceutical companies about how they handled this, and it was quite clear they were a lot more proactive and they invested more time and effort into engaging with some of their key stakeholders. And so I was able to recruit an excellent guy to help me to lead my public affairs team, to help us engage with government and various other departments. It is important for us because they are a major stakeholder and we can help provide solutions to many of the problems or opportunities within healthcare in this country. The NHS is a wonderful organisation. It employs 1.3 million people, although it will need another 300,000 people in the next 5 years. Unfortunately, there just isn't enough clinical professionals to recruit. And so the NHS and Department of Health will continue to need to work with partners to help resolve healthcare inequality and access to healthcare. It took us 4 years to acquire our first 100,000 patients in ECHO. It then took us just 4 months to acquire the next 100,000 patients. So we continue to build that very quickly. We also are able to move and build new facilities to help the dispensing of those meds. To meet the surging demand in our what we would call front of shop or OTC sales through our lp.com platform, we moved and created a new warehouse to handle the demand within just 42 days. In our entire history, we'd never built and opened a warehouse in 42 days, which is really quite incredible. I'm proud to say that we had over 2,000 employees who went out to our fields, went out to warehouses to help during that initial pandemic. And I think it showed, my own workforce, how agile and flexible we can be where we need to be. I mean, it's easy to forget actually those dark days in March around the initial COVID area, and people were really quite unsure. But it showed what was possible and how flexible we can be. And I think what I've been impressed with is our organisation's ability to adapt and change. And one of the things we want to do is to continue to keep that spirit of agileness and ability to adapt and respond to when the market or our stakeholders need us to respond, which I think is incredible.
And do you think this spirit of technology adoption, this spirit of innovation will continue? I mean, do you see a sort of a bright future for McKesson in terms of continuing to innovate and continuing to do this sort of stuff?
I think it's super important that we continue to innovate, and I think we have the space to do so. I think the needs of healthcare globally and in the UK remain critically important. Most countries have an aging population. The science around medicines is becoming more and more complex and sophisticated and exciting. And so we have a crucial role to play in terms of ensuring that safe flow of medicines to patients in communities and in hospitals. And I think if you look at many other aspects of business or personal life, digitalization plays a huge part. And I think healthcare will be just the same. People interact in their daily lives with the use of technology, and on the whole, they really love it. For us, we want to use technology as an enabler to great clinical professionals. It's a way that they can better utilize their time and their resources. So it's not really an either or, but I do see digital being a much stronger component part of our business and of the healthcare industry in general.
As a general observation, where do you feel healthcare technology is compared to your previous world of retail and consumer?
I think the healthcare industry is quite far behind other consumer sectors in digitization. When I first spoke 2 years ago about the potential for online pharmacy, people thought I was crazy. But actually, if you look at what percentage of sales and business is done in other consumer sectors now online, healthcare is way, way, way behind. Whilst it is more regulated, whilst we do have to make sure that patient safety is top of our agenda, I think it can be a huge advantage to people. I mean, just a small example, that GPs had maybe less than 5% of their consultations with patients were done virtually. During COVID, it went to 80-90%. Now, we don't own GP practices as such, but it does demonstrate the public's ability and the government and the healthcare industry's ability to adapt to digitization. I'm very optimistic and confident that the clever use of technology with clinical experts and clinical professionals can bring great advantages to the NHS and the healthcare of this country. Without it, the NHS has no chance to meet the public's expectations. As I said, they employ 1.3 million people today. They need another 300,000 in the next few years just to meet the current demands. Unfortunately, because of COVID, the backlog of hospital appointments is staggering. It's going to take years to get back on where we were pre-COVID. Technology can't replace, it's an enabler and an accelerator of helping us to do a better job across the whole industry of serving patients in pharmacy and in hospitals. And so I think we need to be open and creative around how that technology can help the customer and patient journey.
So in a post-COVID world, many now are talking about resetting, rebuilding. What for you are the most important qualities that senior leaders will need to succeed going forwards?
I think this is probably true before COVID, but I think it's even more true post-COVID. I mean, communication is just so important. I think as a CEO, you need to try and provide broad direction and encouragement for your teams, and then kind of allow them to delegate and to do what they need to do. I think that's hugely important. I think having a really clear vision for why people want to come to work. What is the purpose? For us, we play a huge role in supporting the NHS and ensuring we put patients first and ensuring we help improve their well-being. I think that is increasingly important. And I think from a technical perspective, I think, of course, having a grasp of the power of digitization and of data and analytics is increasingly important.
So what sorts of things have you and your senior team, I suppose, done around kind of employee engagement? I mean, we're talking about 22,000 staff. So
yes,
it's not an easy thing to do, is it? So how have you kind of done employee engagement, kept a kind of temperature check of how your employees are doing?
One of the key things we did was we launched a mobile app communications tool that enabled our colleagues to talk to each other and for us to communicate through pictures and videos. And I always find pictures are great at telling a story and really help to get messages across. I mean, I've done a lot more video messages amongst different groups, whether that's town halls or senior leadership groups, where I will kind of talk to and listen to management and leaders and employees around the organisation. We found that to be a good way of engaging. We have a number of what we would call pulse surveys. So these are quite sort of simple, quick questions we ask employees around the organisation, and we find that really helpful. And they seem to like doing it and giving us that feedback too.
How have you kind of kept that kind of team spirit together?
So in terms of my direct reports and our sort of senior leadership team, clearly we talk a lot, but we haven't been able to physically get together as much as anything like what we used to do. So we do have a sort of rotational basis in our support centre. So we sort of take turns to come in here and be present. And so sometimes there are several of us here together, of course, socially sort of separate apart. We do a lot of our meetings on Teams, and proud to say we've continued our personal development as a team. So it's some work we started pre-COVID with a sort of outside organisation to help us. But we felt actually, even though we're super busy, now is probably even more important for us to invest in understanding ourselves as individuals, but also understanding ourselves as a team and how we can work better together. And so during that, we've had some open and honest conversations between us around what works and what doesn't work and how we can work better together. And I think just discussing that is at least 50% of the solution to the challenges that faces. We've had some evening drinks virtually online as well, and some sort of quizzes between us, and we all like to share via WhatsApp and things some amusing moments or photos that we've come across. And I think we are in a serious business of looking after patients, but if you can do that also at times with a bit of light humor and a bit of fun, it just puts a spring in your step and just helps you come to work with a smile and to do the best that you can.